Hello, good day. We are continuing with our series of knowing your e-portfolio, and today we're going to be talking about clinical experience. A few disclaimer is that one, I am not employed by the 14 Fish, neither am I an expert in e-portfolio. I'm just sharing my experience. Hopefully, it would help your engagement with your e-portfolio. And I also encourage you to read a little bit more about some of these topics on our CGP website or even the 14 Fish as well. And watch some of my other videos, like it and share as well. And do leave your comments, greatly appreciated. So let's go swiftly to the topic today, clinical experience group. When you make your entry, there are patients that you see. Every patient that you see in your training will fall into any of this clinical experience group. And what we are encouraging is that when you do make your entry, that you categorize your patient into any of these. So take for example, there are about two, four, six, eight, nine of them. Yeah, there are nine clinical groups, and in your in clinical sorry, in your entry, you are allowed to put a maximum of two clinical groups in any entry that you make. Or you could also put one, but the maximum that you are allowed is to put two. So take for example, if I see a young child with his or her parents, say about five or thereabout, that is somewhere I can put it because that falls into the clinical group: infant, children, and young people less than 19-year old. So any patient that you see that falls into this group, you can click it and add it to your entry. The other types are gender, reproductive, and sexual health. And I think even in 14 fish you will see some other something about LGBTQ, breast, and all of that. So anything about reproductive health, if you are examining um, a male, for example, you examine a prostate, doing a prostate examination or doing a testicular examination, these are where it comes into. So that person, though maybe less, it may be in the maybe a child, but also that entry or that engagement, you have done something with the reproductive health. So that is where you can put it. The other groups are people with long-term conditions, say for example cancer, hypertension, things like that, diabetes, thyroid disease. So if you see any patient, it doesn't matter how old they are, but if they fall into this group of having a condition that is long term, yeah, that is where you put them. The older adults, including frailty or people with end of life. So the word actually simply explains itself. It just means that anytime you see patients of this kind, you choose them as part of your of a part of the group in your entry. So mental health, anybody with depression, anybody with alcohol, substance misuse, addiction, any of those things, that is where you would categorize them. Urgent and unscheduled care, those are people that just come to you promptly, especially when you're on call. For example, it's not a scheduled appointment, it's not an elective thing. It just happens and they show up. That's where you put those kind of people. People with health disadvantage and vulnerability. It just speaks about people that are vulnerable, people that have safeguarding issues. So that's where you put them. Population health and health promotion, in your consultation, if there was anything or any condition that had to do with the population, like take COVID for example, or or a condition that is affecting everybody, or that is rampant in the population, or that is quite peculiar to that district, that is where you put them. So lastly, clinical problems not linked to a specific group. So that just means that those are people, anything that happens to young, old, male, female, adults, male, any kind of patient, that is where you put them. There are clinical problems that do not, it's not a particular group of people that have them. So remember, when you do your clinical entry, there are two clinical groups that you are allowed to put, but you can put less than two. And always remember, any patients that come in front of you, you want to see where do they fall into these clinical groups, and that is how it helps your putting your entry in, and going about your e-portfolio. So I hope this has helped, and I wish you all the best in your e-portfolio engagement. So remember, share and leave your comments, which I greatly appreciate, and like it as well if you do like it. Bye.